The ATD Automatic Crown and Bridge Remover is a handpiece system designed to remove cemented crowns and bridges. The ATD Automatic Crown and Bridge Remover 20-to-1 reduction gear handpiece attaches to electric or slow-speed air-driven handpiece motors and is used at speeds between 5,000 to 25,000 RPM. The ATD device comes standard with a variety of site-specific hooks and wires. When activated, the device delivers intermittent strokes at regular intervals, producing a vibration that resonates through the cemented crown or bridge. This action breaks down the integrity of the cement to dislodge the prosthesis. The ATD Automatic Crown and Bridge Remover is fully automatic and very simple to use. Unlike other crown and bridge remover models, you are in complete control of the intensity of the impact needed to remove the crown or bridge. This provides less stress on the root structure and makes it much safer and less traumatic for your patients. To test the stroke for crown and bridge removal, pull the shaft of the working end away from the handpiece. The intensity adjustment ring located at the neck of the unit is used to increase or decrease the intensity of the strokes. The ATD will deliver a very gentle 10 newtons force per stroke, compared to manual systems that produce 75 newtons and pneumatic systems that deliver 35 to 45 newtons. It is easy to see why the ATD is so revolutionary. Stroke frequency is directly proportional to the RPM. The maximum frequency is 20 strokes per second. Once activated, the ATD taps the fixed unit repeatedly by simply applying a light amount of pressure on the fixed unit. Begin by starting at low to medium frequency. If not effective, the unit can be increased by increasing the speed. In choosing attachments, there are two basic varieties: hook attachments and wire attachments. For safety and maintenance, please follow the instructions included in the manual. In this case, an anterior temporary crown is going to be removed. Due to the fact that there is no purchase point, one will be made using a burr to create a ledge and therefore a purchase point for the ATD remover. Here we'll be using the flat hook crown remover. It's important to remove the temporary material very carefully so as not to harm the tooth structure underneath the temporary crown. Here, the flat hook is placed against the ledge that we have created in the temporary crown. It's important to align the flat hook against the long axis of the tooth. The ATD is then activated and the temporary crown is easily tapped off. Here, an anterior crown is going to be removed using the short-angled hook. Here, the short-angled hook is placed under the margin at the gingival and aligned along the long axis of the tooth. It's important to align these hooks along the long axis of the tooth to ensure easy removal of the crown. Note how quickly these crowns are removed once the ATD handpiece is activated. When dealing with the removal of a crown in the posterior, access is one of the most difficult things. Here, the long-angled hook is designed with a 90-degree bend at its tip. The long-angled hook is engaged under the buccal margin of the crown and aligned along the long axis of the tooth. It's important to allow the initial vibration of the ATD device to be engaged in order to break the cement seal between the crown and the tooth. Once the vibrational resonance has been activated and the cement bond initially broken, then the ATD can be activated by pulling on the device and the tapping initiated. Once the tapping has occurred, you can see that the crown is easily removed intact without any damage to the porcelain or the underlying tooth. When removing a 3-unit bridge, one has the option of using either the 90-degree bridge hook or the 60mm wire. In this case, the 90-degree bridge hook is used. The hook is engaged between the pontic and the abutment, in this case, the first and second premolars. Vibration is allowed to occur, and initial tapping ensues. A small amount of tapping is allowed to occur, and then stopped. Following this, the hook is then engaged between the pontic and the distalmost abutment, in this case the second premolar and the molar. It's important to allow even distribution of tapping to occur between both abutments. This way, undue stress isn't placed on either abutment, avoiding fracture, allowing even distribution of forces, and therefore easy removal of the entire bridge unit. Here, you can see how easy it is once that even distribution of forces has been applied between both abutments. After 3 quick engagements between the abutment and pontic, the bridge is quickly and easily removed. Here, a patient presented with a Maryland bridge that had become loose from the abutments due to a failing cement bond. The 50mm wire is used between the wings of the Maryland bridge and the abutments. It's important to place the wires between the wings that are cemented strongest to the abutment teeth. We don't want to engage the wires where the bridge is most loose, because that would cause bending or warping of the bridge. Therefore, we would like to create tapping of the bridge where the wings of the Maryland bridge are strongest, or where the bond is strongest between it and the abutment teeth. In this case, the 2 anterior incisors. Here, 2 50mm wires are placed and tapped individually until the bond is broken between the Maryland bridge and the abutment teeth. As you can see, the bridge is removed completely intact, the porcelain is unharmed, and the bridge is now ready for cleanup and re-cementation. In this case, a posterior 3-unit bridge is being removed. Here, a more distant view is used to appreciate how the wire is threaded through the bridge and attached to the wire removal system. The wire is carefully threaded through the bridge, and the adapter and wire attachment are locked together. The ATD unit is then activated. Vibration is allowed to occur, breaking the cement seal. The unit is then pulled, full tapping is then activated, and the bridge is easily removed. In this case, a 6-unit anterior bridge will be tapped off using the 150mm wire multiple loop. The wire is first threaded between the pontics, numbers 7 and 8, between the right lateral and central incisor. The wire is then looped through the attachment and then again threaded, this time between the left lateral and left canine. The abutments, in this case, on the left side, are the central, lateral, and canine. Once the wire has been threaded through the interdental space, it is then locked into place. The multiple loop wire attachment is then attached to the adapter for the wire attachments, and then the entire assembly is straightened. Here, the wire loop on the right side is moved over 1 tooth position between the right lateral and right canine in order to place it between the pontic and abutment tooth. The entire assembly is then straightened out according to the long axis of the abutment teeth. Vibration is allowed to occur by activating the rheostat and therefore activating the ATD handpiece unit. The ATD handpiece then is activated and the bridge is easily tapped off with several strokes. Note that in this case the multiple abutments are unharmed and the bridge is completely intact.